Thank you very much for joining us today and good afternoon. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 1,357. That represents 5.7% of the total number of tests and takes the total number of confirmed cases in Scotland to 79,017. 433 of the new cases were in Greater Glasgow and Clyde, 267 in Lanarkshire, 163 in Lothian, 148 in Fife and 101 in Tayside. The remaining 245 cases were spread across 7 other health board areas. I can also confirm that 1,228 people are currently in hospital. That is an increase of 21 from yesterday. And 96 people are in intensive care, which is a decrease of 2 from yesterday. And with immense regret, I have to say that 56 deaths have been registered in the past 24 hours of a patient who first tested positive over the previous 28 days. That takes the total number of deaths under this measurement to 3,244. That figure reminds us once again of the heartbreak that has been caused by this virus. I want to send my deepest condolences to all those who have lost a loved one and assure them that they are very much in all of our thoughts. I'm joined today by Dr. Dave Caesar, who is one of our Deputy Chief Medical Officers. Dr. Caesar will be helping me to answer the questions that follow shortly from journalists. Before that, there's a few issues that I'd like to provide an update about today. The first is about the economic consequences of COVID-19, and it's specifically about support for skills during the pandemic. This year, the Scottish Government has doubled to £20 million our Flexible Workplace Development Fund. The fund provides employers with up to £15,000 worth of college or open university training for their employees, and it's designed to help organisations to address skills gaps. The first part of this year's fund, worth £13 million, was aimed at employers who pay the UK Government Apprenticeship Levy. Applications for the second stage of the fund, worth £7 million, will be open on Monday. This time, as well as apprenticeship levy payers, it is open to small and medium businesses, and it is specifically aimed at protecting jobs by helping employers adapt to the impact of COVID-19. For example, at a time when so many aspects of work have moved online, the fund could help organisations to develop their employees' digital skills. It can help with areas such as leadership and management training, and upskilling and reskilling will also help businesses to seize new opportunities as we emerge from this crisis. For example, through language training for small companies exploring export opportunities. So I would encourage any eligible business or organisation to apply. Information about how to do so can be found on the Scottish Funding Council website. My second update today concerns international travel. Last night, the Scottish Government announced a number of changes to the list of countries that are subject to quarantine requirements. Based on an assessment of the latest data, we have now added Greece to the quarantine list. However, the Greek islands of Rhodes, Kos, Corfu, Crete and Zante will remain exempt. We've also added to the list Akrotiri and Dakila, the British sovereign base areas in Cyprus. Cyprus itself is already subject to the quarantine requirements. These changes mean that from 4 a.m. tomorrow, anyone travelling to Scotland from any part of Greece, other than the 5 islands that I have mentioned, or Akrotiri or Dakila, will need to self-isolate for 14 days on their return. Since last Saturday, there has been travel ban on visitors from Denmark entering any part of the United Kingdom, including Scotland. I can confirm that that ban remains in place. In addition, the Scottish Government has also removed a number of countries from our quarantine list. Those countries are Bahrain, Cambodia, Chile, Iceland, Laos, Qatar and the United Arab Emirates. We have also removed the Turks and Caicos Islands. It means from 4 a.m. tomorrow, anyone who travels to Scotland from these places will no longer be required to self-isolate. These changes are a reminder that while the virus is resurgent in much of the world right now, there are real variations between different countries and areas, and the situation can change very rapidly. That is, of course, the nature of a global pandemic, and it's why we are continuing to advise very strongly against non-essential overseas travel at the moment. On Tuesday, the Scottish Government announced changes to restrictions for certain parts of the country, and today those changes come into effect. The first applies to people living in Shetland, Orkney and the Western Isles. Residents of those islands are now able to meet with one other household inside their homes up to a strict maximum of 6 people. However, in order to minimise risk of the virus being imported, we're advising anyone who goes to or returns to the islands from the mainland to avoid in-house mixing for a period after their return. The second change applies in Fife, Angus and Perth and Kinross. From today, those local authority areas have moved from level 2 to level 3. The Scottish Government website sets out the detail of the level 3 restrictions. However, there is one specific aspect of the guidance in relation to this level that I want to highlight. If you live in a level 3 area, which now includes Fife, Angus and Perth and Kinross, you should not travel outside your own local authority area unless it is for an essential reason, such as work that can't be done at home, for healthcare or for caring responsibilities. And if you live elsewhere, you should not travel into a level 3 area except for the same essential purposes. In addition, of course, our advice to everyone right now is that you should not travel to other parts of the United Kingdom unless it is essential. I appreciate how difficult these restrictions are, and nobody likes the fact that they have to be in place. But they are essential if we are to stop the virus spreading from high prevalence areas to lower prevalence areas. So please follow the travel guidance, and if you are in any doubt which level applies where, the Scottish Government's website has a postcode checker that can help you to find out the relevant information for your area. I've spoken in some detail today about the guidance on travel. In a moment, I will quickly recap the other general rules and guidelines. Before I do that, though, I want to acknowledge one piece of very, very good news. Like many of you, I was in a high state of nerves last night, watching the Scotland men's football team take on Serbia. And so I want to take this opportunity to congratulate the Scotland side on qualifying for Euro 2020. It is a magnificent achievement and a real piece of bright good news for us all. After a very tough year, the team have given the whole nation a lift at a time when we really needed it. And we can all now look forward to Scotland taking part in the tournament next year after such a long break from these competitions. But to put us in the best place to enjoy that, we have to suppress the virus. So before we move on to questions, let me remind you once again how we can all play our part in doing that. At the moment, none of us outside Orkney, Shetland and the Western Isles should be visiting each other's homes except for the very specific purposes, such as childcare. When we are meeting people from other households, either outdoors or in places such as cafes, the limit is 6 people from a maximum of 2 households. Avoid car sharing if you can, work from home if you can. Download the Protect Scotland app if you are able to do so. And finally, remember the 5 key rules that we can all use to reduce our chance of getting the virus or of passing it on. Remember face coverings, remember to avoid places with crowds of people, clean your hands and clean hard surfaces, keep 2 metres distance from people from other households, and self-isolate and get tested immediately if you have any of the symptoms of COVID. The rules will help to protect us all, to protect our communities, and to protect our National Health Service, and they will also help to save lives. So please continue to stick with it and to stick together, and thank you to everyone who is doing that. You are making a real difference in the suppression of the virus. We'll now move to questions, and the first question will be from Jamie McIver of the BBC. Jamie.
Hello, good afternoon, Deputy First Minister. Well, last night, of course, we saw many people simply lose their inhibitions and celebrate after that penalty shootout. We saw people simply disregard the rules on social distancing, which after so long are very hard emotionally. But how much longer is it realistic to expect people to always hold in their natural feelings and emotions, especially as Christmas and New Year approaches? And separately, we've heard of one Scottish doctor who had to wait 70 hours for a coronavirus test result this week. Is it right that medics are having to be taken off the front line for so long in order to wait for results?
Okay, let me take the first part of your question, Jamie, and then I'll ask Dr. Caesar to deal with the point in relation to the COVID test. I think we all understand that there is a natural appetite for people to celebrate in the aftermath of what was a very, very anxious evening last night, and all credit to the Scotland team for their resilience and perseverance. But there's also been resilience and perseverance on the part of football fans for the last 22 years when we've been absent from these competitions. So I think we all understand the natural desire to celebrate. But, and of course there has to be a but here, the virus is a very real threat to all of our lives and our communities and to our loved ones. I've had to report today some terrible statistics about the number of deaths that have taken place from coronavirus. So although we're all frustrated and fed up with the restrictions, and when something comes along, like a magnificent Scotland football team victory, we all naturally want to celebrate. But I want to share with you some words from the Director of Public Health of NHS Grampian, who put this out this morning in relation to some of the celebrations. I can say this virus does not rest. It does not take a minute off, much less 90 minutes extra time and penalties. Letting our guard down gives it the opportunity to pass from person to person, and as too many families can confirm, it can have deadly consequences. Now, I agree wholeheartedly with that. Yes, we want to celebrate, but we all have to understand that following the social distancing rules and the facts guidance that I've set out are critical to interrupt the spread of the virus, because what the virus needs, frankly, is human contact, and we're all missing that. You know, we're all missing the opportunities to celebrate and to embrace and to hug and to, in the way that we would normally do with our loved ones and our families and our friends. But if we let our guard down, the virus will have an opportunity to spread. So what I'd say to people is we've just got to always keep our guard up, and if we do that, then we will be able to make more progress in suppressing the virus, and we can look forward to enjoying in happier times, when we've got the better of the virus, some of the celebrations that we all look forward to in the years to come. Dave.
Thank you, Deputy First Minister. So in answer to the question around testing of frontline staff, just worth bearing in mind, of course, we want to be constantly working towards an improved turnaround time for tests for frontline staff, as well as anyone who's getting a test. We know that it's a crucial part of that pathway, not least because it enables people to isolate more quickly, so saving the potential to transmit the virus to other people. And in health and social care workers, that's even more important given the environment in which they're operating. It's worth remembering that we've done over 1 million tests in Scotland since the beginning of the pandemic. The average turnaround time in labs is 17 hours. The average time for a result being available for individuals is under 48 hours, and the most part closer to 40 hours. So in that large volume of tests, we are getting that turnaround time down all the time. And we already have routine testing available for health and social care workers in the most vulnerable areas, and we are looking in the next 2 to 4 weeks to enable a greater expansion of that routine testing programme. And that's what we will continue endeavouring to do as technology allows us to do that, more certainly in order for people to be at work when they need to be caring for people when they need to be, and also to enable us to look after the most vulnerable.
Thanks very much, Steve. We'll now move on to Ross Govins from STV. Ross.
Afternoon, Deputy First Minister. On the fans ignoring social distancing, could we see a scenario of you closing pubs, even in areas where they can open for future big matches, if social distancing still has to exist? And another brief question, looking ahead to next week, how close are we to areas of the Central Belt moving into level 4 restrictions?
Hey, thanks, Ross. On the question of the arrangements for pub opening and the whole question of social distancing, we obviously keep these issues under very active review. We've tried to put in place proportionate arrangements for the opening of hospitality to different degrees across different levels, and different arrangements exist between level 2 and level 3. So we're trying to be as accommodating of the ability of pubs and hospitality organisations to be open. But they've always got to operate consistent with the social distancing rules that are in place. And if we don't see that happening, then obviously we would have to revisit some of these regulations, because social distancing is critical in enabling us to interrupt the spread of the virus. And one of the reasons why we've been able to open hospitality is we've had a tight regulatory regime. We have had very strict arrangements in place about how people should enter, how they should leave, and how they should behave when they're in there. When those rules are not followed, then obviously that raises significant challenges for the government and for regulatory authorities. So the issue is kept under very active review and is considered within the overall assessment of the state of the pandemic within Scotland. Which brings me on to your second question, which is about the consideration of the appropriate levels for individual local authority areas. We have carried out the first review of those levels, having set them and applied them on the 2nd of November. And of course, today, as I said in my comments, some of those changes come into effect with a loosening of restrictions in the islands, and a tightening of restrictions in Fife, Angus and Perth and Kinross. Now, we're obviously undertaking the work now to prepare for next Tuesday's statement, which the First Minister will offer to Parliament, which will set out any further decisions that we're taking. And I think it's fair to say, as the First Minister made clear in Parliament yesterday, that we are seeing still a very strong prevalence of the virus within our country. We're seeing some examples of improvements, but a number of areas in Scotland, particularly in the Central Belt, remain with very high levels of the virus, and the level 3 restrictions are not significantly reducing the prevalence of the virus. So there is active consideration underway to the appropriate levels. That may include consideration of areas going up to level 4. The government would want to avoid that if we possibly can do, but it's certainly under active consideration given the prevalence of the virus and the fact that we're not seeing the levels of the virus coming down as sharply and as firmly as we need to see them coming down in key parts of the country. So we'll set out the conclusions of that exercise to Parliament on Tuesday, and obviously there will be extensive dialogue with local authorities and extensive analysis of all of the information that's available to us over this weekend to inform those judgments that arrived at and announced to Parliament on Tuesday. Can we move on now to Alan Smith from Bauer? Alan.
Thank you, Deputy First Minister. On the point about international travel, Radio Clyde and Radio Forth have spoken with bosses at Glasgow and Edinburgh airports who are frustrated at the lack of progress on moves towards airport testing. They fear that we're now falling behind other European countries on this, especially after mass rapid testing was announced for students this week, which is something that the airports have been calling for some time. 2 months ago, we were told alternatives to quarantine were being looked at by clinical advisors. Can you tell us if there has been any progress made in those last 2 months towards this type of testing?
I'll bring in Dave Caesar in a moment just to give some of the clinical depth to this point. But the very clear advice that we have had and which we are following is that quarantine remains the most effective approach to take to tackling any particular issues that arise out of international travel when people return to this country. And that's what we've followed and what we've recommended individuals to observe, and our whole approach is designed to support the approach to quarantine. Now, of course, we are undertaking an examination of what are other approaches that might give us as robust an approach and protection as quarantine. We haven't come to conclusions on that yet, and we continue that dialogue with the airport operators, with our clinical advisors, to enable us to get to that point. But I think the key point that we have to emphasise is the importance of following the advice that we have on quarantine, and for individuals to make sure that they are following that into the bargain. And we'll continue to have dialogue with the airport operators on this question, but we also must pay significant heed to the clinical advice that we receive on the importance of quarantine and how effective and robust that is as an intervention. Dave.
Thank you, Deputy First Minister. So, as you'll know, there is a clinical strategy for testing that we published at the end of October, which highlighted the priorities as we deemed them then, which is, of course, to ensure that our testing capacity enables us to test accurately and rapidly to enable good patient care, first and foremost, those with symptoms in the population, and then, of course, to prevent outbreaks amongst the most vulnerable. It would be very hard to argue against that as the priorities for a testing strategy nationwide. But, of course, we are understanding that technologies are changing all the time, and we're going through a rapid process of learning from those new technologies, and many of you will be aware of some of the plans to have those rolled out across the home nations over the next few weeks. We're constantly exploring, constantly interrogating how that might be used for different areas of Scottish society, but we need to ensure that we're not testing just for the sake of testing, and we have to understand that testing in itself is not a panacea. It doesn't necessarily tell us everything that people might think it does. So some of the new technologies aren't as good as the existing in-hospital clinical technologies of saying whether you have the virus or not, especially if you're not displaying symptoms. So we need to be really careful about how we roll these out more broadly if we're not understanding what they can tell us and what they can't. And what we don't want, of course, is for us to put our faith in something that then actually increases the chances of community transmission of the virus. So we're really cautious to make sure that we have everything around an increase or a change in testing absolutely watertight, and we're undertaking that as fast as the technology will allow us at the moment.
Okay, thanks, Dave. We'll now move on to Becky Clark from Global. Becky.
Good afternoon, Deputy First Minister. If I may return to the scenes that we saw in that video from that bar in Aberdeen last night. How worried are the government? Obviously in Aberdeen, it's one of very few places in Scotland where pubs can be open at the moment till that time at night and serving alcohol. How worried are you about potentially opening up pubs later in other areas that could lead to similar scenes there? And we've heard from police that no one was fined or arrested for what happened in that place last night. Do we need to be toughening up the restrictions if really the only consequence for people acting in that way is potentially a call from track and trace?
Thanks, Becky. Obviously, I've seen the footage from the incident that you're talking about in the pub in the city centre in Aberdeen, and we've heard from Police Scotland that they are working in close consultation with the local authority, environmental health and licensing teams to investigate the full circumstances of that incident. And it's really important that the police, environmental health, the licensing authorities look very carefully at all the circumstances to ensure that the arrangements that were in place were appropriate. I am advised by the police that a number of individuals were ejected from the premises because they did not follow the physical distancing requirements that the pub required, and obviously demonstrates there was intervention to make sure that the rules were being followed. Now, of course, it is very important that everybody follows the physical distancing rules at all times. And you asked a specific question about the arrangements within pubs, and as I answered earlier on to the question from Ross Govans, we do keep these issues under active review, because if we find, for example, that the arrangements that we have in place are not being properly followed, then there will be a consequence to that, because that opens up the possibility of further transmission of the virus. And we are spending a lot of our time, members of the public are making incredible sacrifices, businesses likewise, to try to make sure that we follow the rules and avoid any bridges for transmission being able to be established. So we have to keep these issues under review. We expect everybody to follow that guidance. I understand that people are obviously overjoyed last night, well, overjoyed at some moments, less happy at other moments, but it's important that on these occasions, and on any occasion, we follow the physical distancing rules, because that's one of the most effective interventions we can all make to stop the spread of the virus. But we will keep these rules under review to make sure that we have the appropriate arrangements in place to stop the spread of the virus. If I can now come on to Neil Pooran from the Press Association. Neil.
Thanks, Deputy First Minister. On the plans for a COVID vaccine to be rolled out, the UK government says that when the Brexit transition period ends on 1st of January, this wouldn't affect the rollout of the vaccine at all. Do you share their confidence in that, or are there any fears that disruption around Brexit might also affect the rollout of the vaccine? And if I can also ask the Deputy CMO, with regard to the situation in the Central Belt, where the figures still aren't going in the direction that we want them to, is there any evidence around which specific parts of the restrictions people are finding difficult to comply with? Obviously in Glasgow, there's been restrictions for quite a while now. Is there any particular element of it that is proven to be hard for people?
Thanks, Neil. I'll say a little bit about both points, and then I'll pass on to Dave to comment on the second part of your question. In relation to the impact of Brexit, obviously we have seen the developments of the arrangements that are in place to deal with the consequences of Brexit, but none of us are certain about what those arrangements will be. So I think the honest answer to your question is there must be an anxiety that there is the potential for disruption to medical supplies as a consequence of Brexit. That was very much one of the critical risks that the Scottish Government identified when we looked at the possibility of a no-deal Brexit scenario at different stages in the past. And when I think back to those examples when it looked likely that we were going to leave the European Union without a Brexit deal, there was one of the highest risks was about disruption to medical supplies. Now, we obviously, at different stages, brought forward additional supplies to make sure that we had stockpiles of supplies in place, and some work will have been done to sustain those supplies. But we're also dealing now with a pandemic, and that's part of why we think it's really very damaging for us to be contemplating leaving the European Union at a time when we're dealing with the pandemic and all of the challenges, the logistical and operational challenges that come with handling the pandemic. So I think there's deep anxiety within the government about those questions. We hope to avoid any of these examples, and we will work to make sure that is the case. But I certainly can't say to you, in all honesty today, that I don't think there's a possibility that there could be disruption to either medical supplies or vaccine supplies as a consequence of Brexit, but we will do everything in our power to avoid that happening. Now, on your second question about the Central Belt, one of the comments I made earlier is that, and you mentioned it in your own question, we have had level 3 restrictions in place in large parts of the Central Belt for quite some time. And we are seeing that the number of cases being pretty stubbornly high, to be honest. And we would like to see those numbers coming down more aggressively. That's not been the case with the level 3 restrictions, which is why we're having to give consideration to whether the level 3 restrictions give us enough of a supportive and effective set of arrangements to try to reduce the prevalence of the virus. And that's the active consideration that's going on over the weekend to determine whether or not any of those level 3 areas should go up to level 4 because of the need to take more dramatic action to try to reduce the prevalence of the virus, given the fact that it is remaining stubbornly high. Dave.
Thank you, Deputy First Minister, and thank you for that question, which is absolutely of the moment. I think the first thing to say is that the vast majority of people, somewhere around 80–85%, are still doing incredibly well in following the guidance as it's described. And we know that with time, that is feeling and becoming more difficult for them to keep that really good motivation going. And it's a constant consideration of us within Scottish Government, and we have a group that is looking at these particular issues that draws from some really world-leading expertise around behavioural science and how we communicate with our citizens and understand their hopes and fears about how we can make it easier for people to follow the guidance when it's there. So that is research that is planned and ongoing at the moment, and we're building our understanding of that all the time in these areas as well as across other areas in Scotland and internationally. So it is something that we're very thoughtful about. It is something that we are understanding more as time progresses, and something that we are actively embarking on understanding even better than we do now.
Thanks very much, Steve. We'll move on to Paul Hutchin from the Daily Record. Paul.
Thanks, Deputy First Minister. Every day the Scottish Government impresses upon people the importance of abiding by the rules. And I think you've been clear that if people don't abide by the rules and infection levels remain high, then you're going to consider further measures. But in the same breath, one of your own MPs, Margaret Fergusons, travelled from London to Glasgow after testing positive for COVID. So could you just explain to people who have made enormous sacrifices over the last 8 months why it is that she has not been expelled from the SNP?
Well, Margaret Ferrier's membership of the SNP was suspended immediately. It became clear what had happened, and that was the action that we took right away. There is then a process has to take place to decide whether that suspension turns into expulsion, and those processes will be taken forward by my party. But I think nothing could be clearer from this podium over all of the time that's taken place since that incident took place, that the First Minister, myself, the Government, the SNP, has made it absolutely clear that Margaret Ferrier's conduct was unacceptable and that the right thing for her to do was to resign, and I would reiterate that message today. We'll move on to...
Just for a quick follow-up, can you guarantee that this internal SNP investigation will be completed this year? Because, she's admitted it, she's apologised, and people will be wondering what is there actually to investigate.
And, that process will be taken forward by my party. This is a government briefing on COVID, and I'm trying to be as helpful as I can answer my questions, but I'll leave that for the SNP to come back on. But from this podium, it should be absolutely crystal clear that Margaret Ferrier's actions were unacceptable, and as a consequence, we believe that she should resign. OK, so we'll move on to Paul Malek from the Courier. Paul.
Good afternoon, Deputy First Minister. I'm wondering if you could give us an update as to whether GP surgeries will be open, forced to stay open, or closed over the Christmas holidays, and whether or not the coronavirus vaccine implementation programme, which might be in place by then, will have any effect on that.
We'll obviously, I'll bring Dave Caesar in to talk about this. We'll obviously have discussions with the health service on an ongoing basis about the practical arrangements for the delivery of the vaccine, should that hopefully be available within the timescale that we envisage. And obviously there will be distribution arrangements that will be taken forward that will vary around the country because of the nature of our geography and the distribution systems that will need to be in place to handle the virus. And in many circumstances that will involve GP practices. Now, obviously there'll be dialogue at local level about the arrangements around about the festive period. There's lots to be sorted out about the festive period before we get there, but making sure, as there always is on a 24-hour a day basis, the availability of accessible healthcare facilities for members of the public will be an absolute priority for the government over the Christmas period, as it is in any other time of the year. Dave.
Thanks, Deputy First Minister. I'd really just echo that point, which is that GPs are always available over the festive period, and as we've seen over the last, for as long as I can remember, but especially over the last 9 or 10 months, they've been at the vanguard of the response, and actually in many ways have radically changed some of the ways in which they have treated patients, ensured that they remain accessible, and in many ways have embraced new technologies in ways that were unthinkable this time last year. So our GP colleagues, the community teams, our nurses, AHPs, community pharmacists will all be contributing to that effort over the winter and over the festive period, as they always do. The specifics about particular opening times of particular surgeries, we are undertaking, as we always do, conversation with our colleagues in community settings to ensure that we get the absolute best balance of requirement with availability. Regarding the vaccine, there is still, as you mentioned, a number of unknowns about how and when that can be delivered. So it's really too early to say exactly the mode at which that will be delivered, but of course GPs will play a role in that, as will many other practitioners within the health service.
Thanks, Dave. Michael Blatley now from the Daily Mail. Michael.
Thank you. Good afternoon. If I could please, first of all, just pick up on the Deputy Chief Medical Officer's answer to Neil at PA. I think you said that 80 to 85% of people are still doing incredibly well. Is that figure actually based on particular research? And does it mean that potentially up to 1 in 5 people are not following the rules? And is that a cause of concern? Also on the issue of travel quarantine, the UK government set up the Global Travel Task Force to come up with recommendations on whether a different approach can be taken. It's recommending a joint testing and quarantine plan where there would be quarantine and then testing on day 5. And if somebody tests negative, they could leave self-isolation within 2 days after that. Are you going to consider these findings? Would you like it to be a UK-wide approach, ideally, that you take? And are you open to persuasion that actually that could be safer than the current approach where you have no idea really if anyone is following the quarantine rules?
Thanks, Michael. Let me take on those questions, and I'll ask Dave to add a little bit as well. First of all, on compliance, we are regularly taking the opinions of the public and identifying public attitudes towards compliance and finding out from people the degree to which they are voluntarily complying with the arrangements that are in place. And so the statistics that are quoted emerge from that public research information that we carry out. I think what's important is to remember, well, I suppose both sides of the coin, that there are many people, the overwhelming majority within the country, who are really making incredible sacrifices to make sure they comply with the arrangements. But then the other side of the coin is that there's always room for improvement. And we would encourage, that's why the First Minister and I and other ministers and our clinical advisors take part in such active communication of these messages to make sure that we maximise that degree of compliance, because it quite literally is the case that if we reduce the degree of human interaction within our society and put up as many obstacles as we can to the transmission of the virus through the wearing of face coverings or observing physical distancing or cleaning hard surfaces or avoiding crowded places, whatever we do, we are reducing the ability for the virus to spread. So it really is an individual contribution that we are trying to encourage people to make the length and breadth of the country, and the overwhelming majority of people are doing that, but there's always room for improvement. On the second point about the travel arrangements, the government certainly will consider the material that is emerged from the task force. It's an important contribution, and we will reflect on that in relation to the decisions that we make, and it goes back to the points that I discussed in some of the earlier questions. I'd also make the point that we have been very keen to try to work on some of the issues around travel, and particularly international travel, on a 4-nations basis with the other nations of the United Kingdom. And I think this is an example of where good thinking and good decision-making discussion can take its course to make sure that we put in place the most effective arrangements. Dave.
Thank you. So just coming back to that first point around which Deputy First Minister answered perfectly in terms of the public attitude surveys. So what that tells us is people's intention and recollection of what they would do and what they are doing. Now, of course, we know that that's not always the same as what they actually are doing and what they might transgress on, even unknowingly. And it's that level, that granularity of level, that we're really trying to get down to understand just how we can make it more likely that people will actually do what is required of them, easier for them to do that, and to really understand how we can support that both from a national and a local level. So it's a complex area and requires a lot of consideration, but that's where we need to get to in this. So of course there's room for improvement, and yet when we look when we sort of benchmark as much as you can, it's a bit tricky to sort of benchmark internationally and across the home nations, but we are doing pretty well. So Scotland as a unit is complying well with measures through these mechanisms of reporting. And just to sort of emphasise that point about learning from other approaches to quarantine around travel, there are multiple touch points with colleagues across the UK about the shared experience of different approaches to managing these really difficult, really obstructive things. We know that they're difficult for businesses and for people who want to have their lives play out in a certain way. We are always learning from other areas, and also recognise that we are trying to be as consistent across the UK as possible.
Thanks, Steve. We'll now move to Simon Johnson from The Telegraph. Simon.
Good afternoon, Deputy First Minister. It's been reported this morning that the Scottish Government has contacted the chief executives of Glasgow City Council and several other surrounding local authorities to warn them that a move to level 4 is possible for them next week. I just wanted to confirm that was accurate, and what the other local authorities other than Glasgow were that contact has been made with. And secondly, there was some modelling published on the Scottish Government website for ICU bed demand and for hospital bed demand yesterday evening that suggested some of these same councils, Glasgow, Lanarkshire, could be very close to their sort of hospital bed limit or even exceed it by the end of the month. And I just wondered if that was really limiting the discretion that you have now to keep these areas in level 3. Thank you.
Thanks, Simon. I can confirm that the Scottish Government, or officials of the Scottish Government, have been in touch with a number of local authorities in the west of Scotland about the possibility of the areas having to be increased from level 3 to level 4. Those are in the Greater Glasgow and Clyde and Lanarkshire Health Board areas. We are obviously monitoring. There are a number of other local authorities around the country that have been contacted, because we are seeing in some circumstances quite significant increases in the prevalence of the virus at different levels. So, for example, there's quite a substantial rise in Aberdeenshire, for example, which is a level 2 authority. There's quite a substantial rise in Stirling, which is a level 3 authority within the Forth Valley Health Board area. So it's not just those areas in the west of Scotland that have been contacted. Although they are at level 3, there are other areas in the country where we're looking very closely at as we do on a daily basis, the prevalence of the virus. So that has happened, and there will be further discussions with local authorities. The National Incident Management Team will be looking at all of that data over the weekend, and ministers will be involved in discussions with local authorities between now and the decisions being taken on Tuesday, as I did last week, and along with Aileen Campbell, the Community Secretary. On your second point about ICU and hospital capacity, this modelling information is part of the matrix of information that we look at. We could find ourselves in a situation where cases could be falling, but ICU capacity could be congested with a projection because of high levels of the virus in preceding weeks, that ICU capacity could be under real strain. So we have to make a judgment based on a whole series of information, which is not just about what is the prevalence of the virus today, because the people who are in ICU in 3 weeks, 4 weeks' time probably caught the virus last week when the numbers could have been very high. So we have to look at all of that information in the round, make those judgments about the projections, and obviously engage in dialogue with our local authority partners, because there are wider issues we've got to take into account, such as the social and economic harm that would emerge should we move an area from level 3 into level 4. But there will be a very open dialogue about these questions after scrutiny of the issues by the National Incident Management Team over the weekend. And as I said in one of my earlier answers, we'll report, the First Minister will make a statement to Parliament on Tuesday, which will provide the outcome of that process. Right, if we could move on now to Dan Vavers of The Sun. Dan.
Good afternoon, Deputy First Minister. Just on your plans to carry out mass testing of students before they return home for Christmas. Firstly, this was previously advised by the Scottish Government's advisor, Professor Devi Sridhar, before they came back in September, but this was ignored, and it never happened. And Nicola Sturgeon said at the time that it risked giving the message that if you test negative, you can just live your life normally and go to the pub and socialise. So has something changed the government's mind here? Do you now admit you were wrong? And secondly, we've got the plans for when they go home for Christmas, mass testing, a fortnight of reduced social mixing before they go. But what are the plans for when they come back? Will they return on a staggered basis? And do you think we're likely to see a system of mass testing put in place again for when they make that return?
Thanks, Dan. The first thing I'd say is that we obviously, I think we've been quite open from this podium over the whole course of the pandemic, that we will learn lessons from the different decisions and events that take their course. And none of us wanted to see the degree of outbreaks that we saw when students returned in the summer. We've thought carefully about that. We want to make sure such circumstances don't happen again. So we've put in place the testing approaches which will be deployed towards the end of this month, the beginning of December, before students return home. We've also, as you correctly say in your question, put in place other measures to reduce the social interaction of students to make sure that we minimise the degree of risk that emerges from students returning home over Christmas. And we want to try to facilitate the arrangements of students getting home at Christmas time. We understand the importance of that for families and for students, and we want to put all necessary measures in place to do that. When it comes to the return of students, we've indicated that we expect that to be a staggered return in the new year. We are looking very carefully at the arrangements about that with the universities themselves to make sure that we can take all necessary precautions to enable that. I can't say at this stage that we will be testing students when they come back. There are different arguments around that because they would essentially be coming back into to household bubbles when they come back into their student accommodation. So there's a variety of issues to be thought about in there, and we'll set out exactly where our decisions have been taken in due course in that respect. But what we have got is a means by which students can be tested. They can take appropriate precautions to enable them to get home for Christmas, and those arrangements are now being actively developed with the universities and between the universities and the Scottish Government, and we'll take forward the necessary steps to implement them. Now come to Tom Martin of The Express. Tom.
Hi, good afternoon. Thank you, Deputy First Minister. Just returning to this, these areas of the sort of stubbornly high infection levels. Firstly, for the Deputy CMO, I just wondered, from Test and Protect, can you tell us what settings are the main drivers for infections in these areas at the moment? Obviously, in previous weeks, we've heard about, household gatherings or in pub or other social settings. So I just wondered what the current picture is for, driving this stubbornly high picture. And secondly, for yourself, Deputy First Minister, just given the seriousness of the situation and what you said about the incredible sacrifices of the majority, is it not time for the government to be looking at increasing, for example, penalties for the minority of people who are flouting and simply ignoring what you and Ms Sturgeon are getting up and telling people to do every day?
I think, Tom, on that point, we've always taken the view that the best way to get the virus down is to work with the Scottish people to do that, to cooperate, to be open about the information, and we've been very open about the information and the advice, and to essentially appeal to people to recognise the individual contribution that they can make to suppressing the virus. And this is, to me, absolutely tangible. You know, how we all individually behave contributes to how the virus either spreads or does not spread. If we wear face coverings, if we observe physical distancing, if we wash our hands regularly, if we clean surfaces, if we do all the things that we say in advice, we are minimising the risk of the spread of the virus. So it is really a truly national effort of every citizen of the country to play their part. Now, I personally, and the government takes the view that we'll make much more progress if we engage people, invite them into that national endeavour to try to make sure we're successful, rather than essentially applying penalty after penalty, although penalties are quite a good thing in Scotland after last night's triumph. But we've got to concentrate, I think, on winning public confidence in the measures that we are taking. I think there is huge degrees of public confidence in those measures. We just need a bit more of it. Now, I also appreciate this has gone on a long time and folk are frustrated with it. I understand that. But then people are also getting into the habit of wearing face coverings. You see it much more readily in all walks of life. People are clearly watching how they're going about their business. We just need to expand and extend that. And I think I'll say a word about the first part of your question before I invite Dave to make some comments. There's never a precise science out of test and protect, but we can gather a certain amount of information, and we know, bluntly, that it's the areas of human interaction that are the points from which the virus can spread. So whether that's about people going shopping and not taking as much care, or going to hospitality and not taking as much care, or household visiting, for example, when they shouldn't be, because we know that household visiting can be such a significant contributor. And when we look at particular outbreaks that emerge, they can often be traced back to, for example, a house party. Well, a house party is just a disaster in this context, a total disaster. And we would encourage people to follow the rules and to avoid that. But Dave, you can perhaps shed some more light on that.
Thank you, Deputy First Minister. So I suppose that there are two or three bits to this question. First thing is that from Test and Protect data, bearing in mind all the caveats that Deputy First Minister has highlighted, in so much that this is what people report rather than necessarily what we can actually see or measure directly. But from Test and Protect data, people report it is shopping, it is personal care, it is hospitality. Now, those are very broad descriptors of what people do on a day-to-day basis, but those are the things, time and time again, every week, that come out as the trends as to what people report being the things that they did in the run-up to getting a positive test result. And then, as Deputy First Minister has highlighted, this is compounded by individual outbreaks where the conditions might be particularly conducive to the virus spreading. So enclosed spaces, poor ventilation, and high confinement of people for a period of time that might be more prone to lots of aerosols being generated. These come in a number of different forms. And then there are the things that we don't know. So we don't quite know how people are mixing in or around the house. We don't quite know how people are mixing in the moments between these touch points. So how did you get to the shops? What did you do at work? How did you get on and off the bus? How did you engage with the dentist or the hairdresser or whatever it is? These are the things that we're trying to get a bit more understanding of, and we're committed to doing that, not to punish people, but to enable just that greater awareness so that people can make better choices, because that will be the key to sustained improvement in the virus. It's not about punishing people. It's about making sure that people understand how they can make better choices for themselves, and that's what we're trying to embark on all the time.
Thanks, Dave. We'll now move to Scott McNabb from the Scotsman. Scott.
Thank you, Deputy First Minister. The cancellation of the exams diet in Wales, announced this week in full, has prompted calls from opposition parties for you to adopt a similar approach in Scotland to the hires as well as the national fives. Is that still on the table? And can you tell us how late you may have to wait to make a call on that, given the arrangements for classroom assessment that would have to be put in place? Thank you.
Thanks, Scott. As you'll know, we've already taken a decision not to run a National 5 examination diet in the spring of 2021. I took that decision back in early October, and we are now providing to schools the assessment materials which will enable teachers to undertake the continuous assessment of pupils on an ongoing basis for National 5. Now, that represents about 60% of the candidates that would be coming forward for exams. So it removes a huge proportion of the number of candidates that would be sitting exams in January. When it comes to the hires and the advanced hires, I consulted extensively about this, and also with young people. And there were different opinions, I readily accept that, but my judgment was that on the balance of information available, it was best that we continue to run a higher and advanced higher examination diet, given that those qualifications represent exit qualifications for the overwhelming majority of pupils in Scottish education. It's essentially their passport to their next stage in education or work. Now, what I've got to be certain about is that that can be achieved fairly for all pupils. So one of the points I've made is that the last moment at which we could potentially pivot from the holding of an exam diet in the spring to a form of continuous assessment is the February break in the school term. Now, I think if we were going to take this decision, we'd have to look very carefully at what was the level of disruption to the education of higher and advanced higher candidates in advance of that moment. So I've already asked for information to be gathered about what's the disruption to education for individual young people in different localities around the country. I've heard some examples where some higher candidates have perhaps had to go through at least one or possibly two periods of self-isolation already. Now that's really, that is becoming disruptive to the education of young people. So I'll be looking at factors like that to determine whether there's a need for us to take a different decision about hires and advanced hires. And I would prefer not to leave it as late as February to take that decision, to give the education system as much opportunity to adapt to a different position if that was necessary. So we're keeping that issue under review. I think the strength of opinion very strongly favours having an exam diet for higher and advanced higher in the spring, but I have to be certain that's going to be fair to every single young person who is going to be sitting those exams, and that will be uppermost in my thinking as I make that judgment. The last question this morning is from David. This afternoon is from David Ball from the Herald. David.
Thank you, Deputy First Minister. If it is deemed necessary to move some areas into Tier 4 next week, is it likely these restrictions would need to be in place for a prolonged period of time to be effective, given the winter's approaching and the sort of lack of progress in suppressing the virus in some of those areas? And also quickly on students potentially returning after the Christmas break, has any active consideration been given to moving lessons to online only after Christmas, given the problems we saw in the summer when students did return?
Okay, thanks, David. I think I'll ask Dave to say a little bit about the issues that would be influential in a decision about level 3 to level 4 status. But I think it'd be fair to say that such measures, if they were taken, would have to be for a reasonable amount of time to enable us to see the effect of those measures. So I don't think they would just be in for a week, for example, because I don't think that would do enough of an impact on the interruption of the spread of the virus. And that's what we're interested in doing here. we're interested in all the decisions that we take about the levels in applying as much interruption to the spread of the virus as we possibly can do. Now, the hard issue we've got to look at about some of the level 3 areas is on the question of whether we think level 3 restrictions are making enough of an impact. And the numbers are so stubbornly high in some of these areas, it is posing the question, perhaps these level 3 restrictions are not doing enough to suppress the virus. So that's the issue that's been looked at over the weekend. We have to do that to make sure that we're taking all necessary measures, because what we've got to be careful about is that as we go through the winter, every week that passes will be more challenging in terms of health service capacity, whether that's because of COVID or normal winter flu pressures or whatever happens. So we have to be looking very carefully, I answered earlier on, about health service capacity. We have to be looking at that on an ongoing basis to be satisfied throughout the winter we've suppressed the virus to such a level that we're not adding to the congestion in our hospitals. And that will be central to the decision making that we make, that we take forward between now and next Tuesday. In relation to students, obviously we set out the other day that we'd be looking at the likelihood of a staggered return of students after the Christmas holidays. That has to be done in a way that does not fuel infectiousness. To go back to the summer, September-October period, we had a significant spike in the virus which came about around about the time of the return of students. We've got to avoid that, because if that's happening in January, it's happening in midwinter when we're under such significant pressure within our health service already. So we have to be mindful of the particular circumstances that return of students is timetabled to happen in a period when the health service will be under a great deal of pressure. Dave.
Thank you, Deputy First Minister. So I guess there are two important concepts around these restrictive measures. First is lag. So there is a lag time of about 7 to 14 days between the implementation of restrictive measures in any form and in any change, and then what we hope to see in a reduction in case rate. And then there is a further lag between that case rate and that converting into potential hospital admissions, ICU admissions, and in some very unfortunate, still relatively rare, proportionately cases, some deaths. So we have to understand the timeline on that, and also where we are in the year. So as Deputy First Minister has highlighted, we are running up, we all know, towards a festive period where many people will be concerned about what they're able to do. And following that, we are in the midst of winter where we know the health service can be under pressure, and we are trying to build all of that into the consideration of what is happening kind of in the next week or two because of that lag time. And the second thing is around the trends. So we have to be certain that a trend is heading in the right direction for a sustained period of time. The up curve of infectiousness is much steeper than the down curve of a reduction in case rate. And that's something that is unfortunate about the characteristics of this disease, but is something that we also have to take into consideration. So building in that time to understand what the behaviour of the community that we're looking at is in relation to the virus cases is really important in that consideration. So the summary of that is they're likely to stay in, but we stay in place for a period of time. But we obviously are reviewing all of the local authorities every week through a very clear process using a number of different indicators, and that will continue whether you're in a level 4, a level 3, a level 1 area. So that will continue despite.
Okay, thanks very much, Steve. That concludes all the questions that we've got today. Can I thank everyone for their interest in this briefing this afternoon. Can I close by thanking Rachel, our BSL interpreter, providing a much needed and much valued service. And can I close by reminding everybody about the 5 key rules that we can all use to reduce our chances of getting the virus or of passing it on: to remember to wear face coverings, to remember to avoid places with crowds of people, to clean your hands and clean hard surfaces, to keep 2 metres distance from people from other households, and to self-isolate and get tested immediately if you have any of the symptoms of COVID. Can I thank you all for your attention? Let's all enjoy and appreciate the tremendous achievements of our footballers last night. It was a moment of joy. It gives us something to be optimistic about and very thankful for, and I wish you a happy and a safe weekend. Thank you very much.